Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center. Ask the doctor anything. I'm Dr. Rita Ellithorpe, and we are in Southern California uh, here in Tustin. And we are a group of physicians, nurse practitioners, physician assistants, and gynecologists. We all practice functional medicine. We have many years, decades worth of experience in functional medicine. And so for our patients, we open up this time to type in a question either by the email down in the bar at the bottom. You can see a link there for our getting on our email list. And then there'll be information sent each week, every Tuesday at 6 o'clock. And you can type in a question. We have all kinds of questions here that I will attempt to answer. And then we have the chat. If you're on YouTube, you can type in your question on chat live. And then I will do my best to answer these. If I don't know, I'll tell you I don't know. This is not meant to be personal medical advice or management, but this is a general educational program. But we like to have something available for the questions in functional medicine, natural medicine, and our experience so that you can see what a real life situation is that we have in trying to help our patients and how we would begin to approach it. So tonight, again, if you have any questions, just type it in the YouTube and then otherwise type out an email and I'll try and get to you. Since I don't see any questions in the chat right now, although I'm going to start trying to go to chat first and answer those for those who are live. Again, if this is of value to you, please hit the like button and subscribe and share this with your friends or family. So we can raise the health and preventative level of everyone. So we begin with a question that was sent to us by Denise, I guess this last week before we took down all the email questions. And it says, "Hi, Dr. Ellithorpe. Can you tell me if EDTA suppositories are good to use in lieu of IV chelation? I have read that detoxamine suppositories have a higher absorption rate and longer half-life than the IV chelation. That's not true. Also, have you heard of huperzine A for brain memory support? And if yes, what should the dosage and frequency be? Thank you for taking the time to present so much valuable health information to us all. We really do appreciate your time and expertise. God bless you always." Well, thank you, Denise. So to your first question, I am the one that helped work with developing the detoxamine suppositories and did the clinical studies on it. And they are by far, or at least were, because I'm no longer involved with detoxamine. It is not to be made available without a prescription by a physician. I always made prescriptions and saw patients when I used detoxamine, but apparently it got out onto the internet, and so it was shut down by the FDA or some, regulatory body. But then apparently some rogue element went out of the country, and so it's made somewhere else. So I don't know, but I'm not a part of that. But what we did originally is we used EDTA, calcium disodium EDTA, 1,500 milligrams per suppositories. We also had a 750 milligram suppository, and we had a 375 milligram suppository for the toddlers and little children. It is and was very effective, and we are the only ones who gave our blood, sweat, and tears and money to try and get a new investigational drug application for it, because it is a drug that should be prescribed. And we spent years and years and time and effort trying to do that, all for naught. It was shut down. So that was quite depressing. I learned about all the unsavory aspects of our FDA many years ago, decades ago. So now, but what did we find? When we had the original detoxamine and we did the animal studies, we did the pharmacokinetics, It was the most effective suppository delivery ever developed in the nation, because there's suppositories where you can have Tylenol delivered to bring a fever down. You can give it to children that way. There are suppositories for things that stop nausea. And the absorption and the blood levels from suppository delivery of medicine is at best maybe 18% of whatever is in the suppositories gets absorbed. We got up to somewhere, I think, in the realm of 37%, where we developed this philosophy that if you took 3 suppositories, it would equal roughly 1 IV. So an intravenous is your gold standard. It's delivering 100% of the dosage of the detoxamin EDTA, calcium disodium EDTA, 1500 milligrams. If you go into the blood vein, you're getting 1500 milligrams. If you give it by suppository at 1500 milligrams, maybe you're getting truly absorbed into the bloodstream, maybe 350, 400 milligrams. Let's see, 30% of 1500, I'm sorry, 500 milligrams. And so the issue was we did that. We did the radioactive labeling. We did the animal studies. We were able to track it. And we actually found a reabsorption, enterohepatic reabsorption biphasic pattern. And so we were very, very pleased. So are they good to use in lieu of IV chelation? If it isn't under our production, I don't know what you're getting in that product over the counter, out of the country, through the internet. I don't know what you're getting, so I can't speak to it. If you go to a physician and you have it prescribed, we've used Harbor Compounding in Costa Mesa. That's the ones who we worked with originally in the study, and our publications and our research and our drug applications. And so they're the only ones I use. So yeah, I don't think it's the best way, but it is a decent way. It's a long-term effective way. 3 suppositories at 1500 milligrams would roughly equal one of our IVs at 1500 milligrams. Half-life. No, the half-life, there is some recirculation, but the metabolism of it is through the kidneys. You pee it out. And so it's pretty much gone within 6 hours, 8 hours. So we're going to say that no, there really isn't any extended half-life with it. So the best is IV, and the length of it in your system is still very brief, 6 to 8 hours, but it is effective, but you have to be consistent. Now, the other question you had was huperzine A, and that is in membrane. I think that is one of the supplements we use for enhancing brain health. I don't know the prescription of the dosing right off the hand, Denise, but yes, it has been associated with benefits. So chelation helps microcirculation, and that even to your brain. And that's why we do chelation therapy for all our Alzheimer's, dementia, memory patients, post-stroke, things like that. But remember, nothing can overcome a bad lifestyle. If you're eating too many carbs and clogging up all those capillaries all the time with sticky, high fructose, corn syrup laden molecules and starch and sugar molecules, and not drinking enough water, and you're inactive, sluggish, you cannot overcome the damage that will do. You might slow it down, but we say this is a whole system where we're asking you to drink your water, take systemic enzymes, use the chelation, EDTA, be on a very low carb diet, and exercise, and not eat late. And you put all those things together plus natural hormones, and we see memory improvement. All right, we had a question here in the chat. It says, from Tara, hi, Dr. Rita, does it matter if you have had long-term versus acute heavy metal toxicity when it comes to full healing? My experience, Tara, is no. Uh, uh, does it matter if you have had long versus acute heavy metal toxicity when it comes to healing? No. Metal is metal, and it's inorganic, and it is a toxin, and there are no safe levels, and they're all damaging, and they all bioaccumulate over time. And so any method and a frequency that you can do to reduce your total body burden is always the right thing to do. If you had an acute exposure to lead or to arsenic or to mercury in a fish versus the slow amount you're getting and what you're breathing, drinking, and eating, just removing it with EDTA chelation and is effective, and you'll get the same end goal by doing it. Are there others? You know, you didn't ask the question, but does cilantro, does high dose vitamin C, does chlorella, does garlic, do all these other things help? Does zeolite, volcanic ash help? Zeolite is something, yes, these are all chelators, and the good Lord has given us many things that help attempt to detoxify our bodies, but there is nothing as good and researched out there as a broad spectrum, safe, non-toxic, administered by a clinician who is trained in EDTA chelation therapy. There's nothing greater than that. And I will be getting mine on Thursday afternoon with my dear friend and scientist, Bob Centenary, and we chelate together and we talk science, and we're the ones who worked on the toxin suppositories. And we're working now on his hydrogenated water and the research from Japan on the extra proton benefit. Let's see, Tiziana in the chat said, so would EDTA help with fibrocystic breast tissue that presents with small benign cysts? Anytime you're trying to improve your bodily health tissue, if you get a better microcirculation going throughout your body, and then you put in enzymes like systemic enzymes like Vitalzyme or Vascuzyme, systemic proteolytic enzymes to try and chew up these fibrocystic breast tissues? The answer is yes. But with fibrocystic breasts, I would also be low carb, and I would also be on iodine because iodine is helpful in preventing fibrocystic breast proliferation. Tiziana. Tara added, just to clarify, the longer metals are in the body, are they harder to remove? Well, we need research. Who's going to give us a multi-million-dollar research grant to do that? And the answer, I'm going to say, from being around this over half a century, I have been involved in heavy metal chelation. And I'm going to say it is difficult, especially when it gets deposited in your bone. But it does come out. And so it is harder the longer it's there, the older the person. So I'm going to say, yes, it's harder. But the net benefits of the vasculature and the microcirculation is equal on every application. So you're going to get the microcirculation nitric oxide synthetase enzyme open up the blood vessels everywhere every time. So hopefully that helps you, Tara. Steven says, what is the best frequency to see benefits from chelation therapy? It all depends. It depends on several things. So let's say the standard we teach at the American College for the Advancement of Medicine is about once a week, but can you do it more often? Yes. What is the maximum dose that you can take? It's 50 milligrams per kilogram. Do I use that on my patients? No, I use 25 milligrams per kilogram because you are removing a toxin. And as you remove that toxin, there can be Herxheimer's or, flu-like feeling fatigued or icky, so to say, as you're moving out free radical toxins. So I don't like to rush this. It is beneficial at any level. So I have determined to have the fewest side effects. I use the 25 milligram per kilogram, which is 1,500 milligrams as a standard dose, and we run it over an hour and a half. And you can do that 3 times a week. We have some who have done it 4 times a week, and it's well tolerated, Stephen. So the least frequency to see benefits from chelation, the least frequency, any one chelation is beneficial. So if you only did 1 per year, you'd get a benefit from it. If you did it once a month, you'd have 12 times the decrease of your total body burden. If you did it once a week, you would have 52 times, because there's 52 weeks a year. And normally we do, after about 30 IVs, we do a measurement called a challenge, where we measure your level in the urine. And this kind of guides us to how the total body levels are coming out. So Stephen says, how frequently should someone test for metals annually? More frequently or yes? Well, it depends, Stephen, on how often you're doing it. I think if you're only doing 10 chelations a year or once a month, 12, then I think, it'd be helpful to know the rate at which you're removing your heavy metals. You will see some reductions. It'll be slower. But I like people to try and get in 30 in a year, which translates to roughly about, 2.5 a month for 12 months. You get about 30 done in 1 year. And that's when we see the more consistent, nicer drops. But anytime you remove a toxin, you're doing a benefit. Okay, Nargis says in the questions here, what is the most important supplement, mineral, vitamin you could recommend for someone with a tremor-dominant Parkinson's? I would do EDTA chelation therapy, and I would have them on vitamin D, and I would have them on N-acetylcysteine or glutathione orally. They could also do the intravenous glutathione. And then they should eat a rich phospholipid diet, the meats, the egg yolks, and things like that, very low carb. So that's what I would say there, Narjas. Harlow asks, hello, my dear sister in the Lord. Praise God. My son has bad allergies, and he says he has polyps in his nose. I suggested D Hist, but I'm not sure how many milligrams he should take a day. He's in his 40s, and he's a positive blood. Maybe you didn't write A, B, or O positive blood. What else do you recommend? Harlow, I would say D Hist has 200 milligrams of quercetin, which is the natural antihistamine per capsule by Orthomolecular, a very foundationally God-fearing company. And that's why I work with Orthomolecular. I really love their leadership and owner there, because I can trust and have been out there to look at their operations at least twice. So it's 200 milligrams per capsule. The first day you take, you have to load your body up, all your mast cells. These mast cells are the allergy, degranulation, inflammatory cells in your body, or at least the major ones. And so you would have to load with about 8 capsules. Day 1, day 2, 6 capsules, maybe day 3, 4 capsules. And I would probably stay on 2 capsules twice a day for a total of 800 milligrams a day, and see if that's enough to see all the symptoms quieting down. But you got to drink enough water, and then I would take those systemic enzymes, Harlow, like the vascuzyme or the Vitalzyme, to chew up all that debris and inflammation and dead cells. And then I would use Argentin nasal spray, which is the antiviral, antibacterial, antifungal, be on a low carb diet, to rinse out the sinuses and then blow your nose, and that should help him greatly. Catherine says, a 71-year-old friend of mine who is generally good in health had a bad fall about 2 months ago, resulting in a severe concussion. She had been doing okay, but now has weakness on the left side, dizziness, slurred speech, difficulty eating, unstable walking, and some falls. Her MRI and CAT scan was unremarkable. After difficulty getting an appointment with a neurologist, she finally has an appointment tomorrow. Please suggest a good protein shake since she has not been able to eat much. Would it be helpful to take 5 Vitalzyme in the morning and in the evening? Wondering what other supplements would be helpful. Thank you so much. Catherine, I would get her EDTA chelation. She needs improved circulation to any damaged tissue, any old bleed, micro bleeding that occurred in the jostling of the brain. Yes, the enzymes, 5 of them twice a day, lots of water. And limited, do a physical occupational therapy exercise to get the pump going through. Very, very, very low carb diet. Now, I don't really have a good protein shake that I like. I would suppose the orthomolecular brand has, what is the name of it? I don't prescribe it often. Yeah, there it is. Inflammacore, because there's inflammation after trauma. So orthomolecular has reliable research tested amounts, because I don't trust these companies that make these protein powders. But orthomolecular powders, Inflammacore, is at least reliable. And chelation therapy and enzymes, lots of water, very low carb diet, a time restricted eating window. And I would try and get her back or him back into, talking, activities, going out as tolerated. And then that's where I would start then, Catherine. Okay. Dorothy says, God bless you and your family and the clinic there. Thank you all so much for your prayers. I really am blessed, and I do believe your prayers make a difference for us here at Tustin Longevity Center, and it's greatly appreciated. You are saving many lives. Well, praise God. I have learned so much from you. Thank you, thank you, thank you. I am doing so much better with my hip and muscles, she says. More flexibility, strength, range of motion with much less pain, stiffness, and soreness. I am blessed to have a great exercise room in my building. I am speaking more now. I'm doing everything you told me to do, and I feel so strong and energetic and full of joy. Glory to God for all he has done and is doing. And her question is, what are some problems with the pure vegan diet? Well, that's a good way to ask it. What are some of the problems? Because there are significant ones. And these are usually the gradual development of deficiencies. A vegan diet is a pure plant-based diet without any eggs, without any fish, without any animal products. It's a pure plant diet. And what happens with that is you get the fat essential vitamins, vitamin E, vitamin K2, vitamin D. These fat-soluble vitamin deficiencies start to emerge. Plus, you get certain B vitamins, B12. You get certain mineral deficiencies, in particular iron. Then there are certain amino acids that are very challenging. And for pure vegans, and I just have to tell you, practicing 40 years, even here in Southern California, I often find people start and you may actually feel healthier and feel good initially with a pure vegan diet. But over time, rarely do they stay pure vegans. They'll have the occasional piece of fish or the occasional egg or the occasional dairy, which all these things are very beneficial in providing some source of these multiple amino acids, fatty vitamins, and minerals back into the diet, and it helps improve these deficiencies. And so this smoldering state of health, it often will take about 7 years, it seems, before they finally go back to eating more of a free-range, wild-caught, prairie-raised diet. So those are some of the concerns I have for anything that's pure vegan. Renee says, I don't have the best health insurance, and I can't find a functional medicine doctor who accepts my insurance. I struggle greatly with my sleep and brain fog, often feeling sluggish throughout the day, usually wanting to take a nap, but can't, and struggling with sleep maintenance insomnia for about half of the month. I eat very healthy. I am on a certain hour going for morning walks every day, yet I struggle with my sleep and daily fatigue. I rarely wake up feeling well rested. My blood tests always come back within normal ranges. Doctors just want to medicate me. But what I want to do is get to the root and fix this naturally. I took the chronotype test several times, and I am the dolphin each time. I'm not familiar with a chronotype test. Do you have any suggestions for people like me who struggle with their sleep and energy, no matter how hard they try to create healthy routines and how many different methods they implement? Thank you. There are many things involved in sleep. Your sympathetic, parasympathetic, autonomic nervous system is in your lower brain here in your brainstem, and it impacts almost every aspect of your well-being, including your sleep and circadian rhythm. It can get messed up with toxins and sleep work cycles, stress, your dietary food corruption with hydrogenated fats and plasticizers and glyphosates. All these things are hurting it. Cell membrane damage from not enough phospholipids. But vitamin D deficiency in the gut, poor good bacteria in the gut, are well associated with a decrease in serotonin and even melatonin production and these cycles. The electronics around us, having your phone near your bed, having the electric outlet to your house near your bed with these electromagnetic waves, electric blankets, even electric clocks and their lighting. The electronics are another issue. How old are you, and what is your exercise level? Are you exercising? Are you eating too late at night? And are you needing digestive enzymes to help you with your evening meals to keep that food from just sitting in your stomach too long? Are you eating enough fats to get the vitamin D absorbed, the vitamin K2 absorbed, the vitamin A and the vitamin E, and all these things that are very important? Do you have enough of the minerals, magnesium for relaxation? Do you have your estradiol or your progesterone if you're a woman, and the DHEA, pregnenolone? Do you have enough testosterone if you are a male? Are you drinking enough water? Because chronic dehydration makes an irritable brain cell membrane. So there's quite a few things that go into this, Jocelyn. And so I would ask you, I don't know where you are at. We do take insurance here, and we have several physicians that would like to probably work with you. But I would start with taking vitamin D and getting your vitamin D levels above 80 micrograms per deciliter, and probably no higher than 120. And then I would probably work with getting a very good probiotic in your gut with B vitamins, pyridoxal phosphate, which is vitamin B5, in a very good methylated B complex. And then I would ask your doctor to help you with your hormones, male or female. And then, Renee could be a male name or a female name. So I don't know if you're a woman or a man. I know male Renees and female Renees. Anyway, So start with that, and then start with your not eating late, and start with a exercise program, and then I would go from there. We do take plenty of insurances here ourselves. Let's see. Harlow said in the chat, Dr. Rita, what is the best way to calm the nervous system? If you want the immediate thing that I have learned to do, it's deep breathing. So you take a deep breath in and hold it, and then you blow out that breath very slowly, and you do that for about 5 to 10 times, and that is probably one of the best parasympathetic modulators that you can do. I think we too often are breathing shallowly, we're too inactive, we're sitting too long. So that's what I do. The other thing to help my nervous system is I focus my brain on, I read scriptures. I read my Bible, 4 chapters every morning. And I just set aside an hour of a day, every day of my life for that purpose. And then I reflect on those words, and year after year reading the Bible cover to cover. I get the Bible done maybe now in about 9 months. So I've read it through and through so many times I couldn't even count that. I just have so much scripture floating up of reassurance. That is very calming to my nervous system. So, and then exercise. Exercise is fantastic for balancing your autonomic and your sympathetic to parasympathetic system, and having routines. To have that morning bowel movement, and to have the water, and your routine is very critical. Let's see, Harlow went on to say, what do you think of juicing with green vegetables only? I don't like juicing. I'm sorry, it's unnatural. And you're turning what would have been a complex carbohydrate through juicing, you're pre-digesting and making available much more of the sugars for immediate spiking of your insulin. So I would go ahead and eat, the green complex carbohydrates, but I would never juice anything. Tara says, also, do you need to take time off of work the following day after chelation therapy, or are you able to function normally? Everyone's able to function normally. I mean, I chelate in between. Sometimes at my lunch hour, I'll do that. And I have busy people coming all the time in the mornings and afternoons, moms, dads, kids, everybody. It's just a very natural thing. Remember, this is safe enough for babies, and we gave this to toddlers, 1.5-year-olds chewing on the lead-based chip paints in Chicago. And then they became acutely intoxicated from a teeny tiny chip of lead-based paint, and we saved their lives. So this is so safe. Harlow says, love you, Dr. Rita. God bless you abundantly. Love you too, back. We're all of one race, Adam and Eve. We came from, and so we're all related. We all are connected, aren't we? I wish we could see how wonderful the scriptures are, and how can you not love everyone when you realize our great grandparents are the same? We're all brothers and sisters, so praise the Lord. Okay, let's go to the next one. Jocelyn, husband has iritis. That's inflammation of the iris of the eye. Has iritis flare-ups, usually occurring a few times a year. Any recommendations for what could be causing and treatment outside of steroids? Absolutely. In fact, I had someone go blind here. She was having optic neuritis, so it wasn't the iris. It was actually the nerve in the back of the eye. So this was a neurological problem. Anyway, it's from the gut, really. It's something he's eating. He's been chronically eating, and now his whole body is having these inflammatory flares when these dietary waves are occurring. So I would, probably if I saw him, I would go with a carnivore diet until all the flares stop. And then I would do the food allergy test. I would do the complete digestive stool analysis to look for the inflammation in the gut and use systemic enzymes. I would take rich phospholipid powders and probiotics and vitamin D and vitamin B complex methylated. Yeah. So that's what I would do. Pam says, hi, I'm wondering if I use the progesterone cream you recommended as a sunscreen, will it affect my hormone balance as I use progesterone and estradiol as prescribed? Yes, it'll have some impact. If you're using the Cocorol, I think it's less than 20 milligrams per dosing recommended dose. That's a very low dose. And so I don't think it would be anything huge. And progesterone is such a wonderful natural molecule. We're bathed in it for a year, whether we are a boy or a girl when we're growing up in our mommy's tummies or their wombs. And it is such a wonderful protective thing. So if you use, 2, 3, 4 pumps as a sunscreen, I think you're going to do fine. Sally says, I would greatly appreciate your thoughts regarding the cause of slightly elevated liver enzymes, AST41, ALT61. Most obvious causes have been ruled out. No alcohol consumption, no over-the-counter drugs used. Liver ultrasound was normal. Labs are negative for hepatitis. Iron and copper are normal. All the other investigative labs are normal. This was the only abnormal finding on routine labs, and follow-up labs have been following dietary and lifestyle recommendations for a year, including a very low-carb, high-protein diet with mainly meat and veggies only. Drink half my body weight in water. Avoid the food sensitivities. Vitamin D is 88. Regular brisk walks. Fasting 10 to 12 hours nightly. 8 hours of sleep a night. Your body mass index is 23. And not using Tylenol or medications. No symptoms. Sleeping well. No jaundice. Good energy, focus. Late 40s is her age, still having regular menstrual cycles, just mildly elevated liver enzymes. Ultrasound for fatty liver was normal. The PCP suggests stopping the use of all vitamins, minerals, and enzymes of any kind, with the exception of vitamin D, K-force, the omega-3s, and quercetins. Labs will be repeated in 2 months. I'm perplexed about the elevation and conflicted about stopping the use of vitamins, minerals, turmeric, and enzymes while adhering to a low-carb, high-protein diet. I'd appreciate your thoughts, possible causes, and thank you so much. We're all unique. In well over 40 years of practicing, I have found certain people have some mildly elevated liver enzymes no matter what. And as long as there's no gallstone found on the ultrasound, which I'm sure it was screened if that you had an abdominal ultrasound. Some people have mildly elevated, and when you put that AST41, some labs will call that a normal range, and I think our lab level has 37 for the AST. ALT, I think, is something like 48 or 47, and you're a 61. So I don't know if that maybe you're one of those rare people that always have a slightly mildly elevated enzyme. And as long as you're stable and you've had a good workup, I don't think we're missing anything. Maybe a complete digestive stool analysis would be helpful besides the food allergy. Looking for inflammation in your gut. That's a complete digestive stool analysis by Doctors Data in St. Charles, Illinois. It's excellent. That's what I use for studying it. What else would I say? I'm not opposed to you being off all vitamins for a month. Just stop it, even 2-3 weeks, and redo the lab and take a look. And if you can correlate stopping it, maybe there's something about the product that is not sitting well with you. So I don't think there's anything wrong with that, Sally. So let's do it that way. I would follow up and follow what your doctor says and stop them for 2-3 weeks. Sylvia, do you suggest any supplements to improve hearing loss? I would do EDTA chelation therapy to improve any system in the human body, or any other treatments, besides hearing aids. My husband wears hearing aids, a nice new model, but is having a hard time understanding sometimes. He cannot hear certain tones. Thanks. So you got to put the whole thing together. Chelation is wonderful, but you have to start exercising, get your circulation going, fasting, eating the healthy phospholipids that repair the cell membranes. Nothing replaces that. Lisa says, greetings, Dr. E. I'm talking so fast. I imagine this is a question you haven't been asked before. Over the last few weeks, I've noticed that the outside of my right ankle and top of my right foot near the ankle have been warm. At first, it was just a few times a day, but now I notice it almost continually. It isn't uncomfortable, but the rest of my foot, other foot, and hands are generally cold. My husband doesn't think it is warm to the touch, but I definitely feel what I call warmth there. Do you have any ideas what this could be? God bless you, and you serve your office and live stream people. Thank you. Lisa, let me get some water. Lisa, what I think that probably is the beginning of a neuropathy, and getting these unusual nerve feelings. So see how I'll take a little twist of my salt, and I'll put a little salt in my water. And then I mix it up with my straw, and I get all those little crystals and trace minerals. Yum, yum, yum. So I think this is a peripheral neuropathy starting up. Nerves have a myelin sheath. The myelin sheath needs phospholipids to make the fatty insulin around the nerves. And when they start to break down, and they usually start breaking down as we get older in life, and it's usually the feet and that we first start perceiving these altered sensations. So when it isn't obviously hot, and yet you're feeling the message of heat, this is what we call a neuropathy. So you can see your doctor or a neurologist. The other thing that you would always want to check is for swelling, any blood clots, things like that. So I would see your doctor. But I would work on eating a phospholipid-rich diet, which is the carnivore type diet, where you're getting all those wonderful fats that every cell membrane, including the nerve membrane, needs, and enzymes for inflammation, water, metered exercise, chelation therapy for the microcirculation, and see how that works out for you. Sylvia, can a sonogram of the breast be done instead of a mammogram and be as accurate or reliable and safer? Well, they're never going to say that to you. The standard of care, the policy here in California, the state medical board wants us to use recommendations for standard of care, which is an annual mammogram. Now, you, the patient, you're an independent, sovereign citizen, still at least yet for a while, and you can run your own body. So I never do the mammogram. I don't do it. And I think I've had two in my lifetime, once when I was 39 and once when I was 58. And I was normal both time, and the second time I got a bruise, and I just will never do it again. Now, I can take responsibility for myself as an individual. And my fasting blood sugar that I just recently did was 62. My HOMA-IR is 0.5, which means I'm very low risk for vascular, heart, diabetes, metabolic syndrome, all those things, because I eat a healthy lifestyle and I exercise regularly and I get my sleep, I drink my water, I take my vitamins, and I don't eat late at night. So there's nothing more I can do than that. So I'm just not going to worry about it. So I myself, I don't do mammograms. I can do my own self breast check when I shower or bathe. If I see my doctor annually and have a pelvic, because I do take natural hormones, they can do a breast check and a pelvic exam and feel for any unusual lumps or bumps. And I can check myself monthly. And beyond that, and seeing your own doctor and checking to see that your insulin is 4 or less, checking to see that your fasting blood sugar is 85 or less, checking to see if your triglycerides are never higher than your HDL, roughly in the 60s or less range. Checking to see if your hemoglobin A1C is 5.2 or less range. If you're doing those things and you're trying to eat a healthy diet, low in carbs, avoiding processed foods, I think you don't have to worry about screening for cancer because it's unlikely. But I would say the standard of care is to do a mammogram, and they're never going to market it, which would bring less money to the hospital or the imaging center. Ultrasounds are helpful. They are a different method totally. And I think there are different parameters and qualities to it that the radiologist is going to say is inferior for detecting concerning lesions. So that's my answer there. You have to be an adult. You have to take charge of your own body and either live a life where you just eat what you want and then you keep on screening until your cancer or heart disease shows up. And then bingo, you ate yourself and had a lifestyle that brought you to the disease. And now bingo, you got it. And you found it on screening, and the system will make all kinds of money off of you. Or you can live a life saying, I'm going to say no to all these things, and I'm only going to keep these treats to legitimate, true holiday, holy day, very special day scenarios, and go from there. Tiziana says, hi, Dr. Rita, what is the name of the company you like us to do the food sensitive with? That's Immunofoods from Fort Lauderdale, Florida. Immuno Blueprint, I think is what it's called. Immuno from Florida. And then Lily says, hi, Dr. Ellithorpe. I'm in the mid-50s and you're a patient at TLC and you're getting good improvement with your health. Thank you, she says in bold. Well, we thank you, Lily. I was on estradiol and progesterone cream for a year, occasionally spotting. I switched to bioidentical patches and the pills 6 months ago, using every day, so I didn't have any periods. I switched from the 0.05 to the 0.1 estradiol patch and the 100 to the 200 milligram progesterone mid-February of 2023. Mid-April, I had a 5-day period, 2 to 3 pads a day. That's pretty typical. A few days, I had another lighter 5-day period. Last week, I started another period. Today is the 6th day. It's getting lighter. What are possible reasons for my periods? Should I cut back to the 0.5 and the 100? Is it better to take a week break from hormones? Appreciate your help. Well, we need blood levels, and we need to do a pelvic exam, probably a pelvic ultrasound. So, Lily, I would be seen. I would come to your doctor and ask for blood levels of what you've been doing. We want to know what you were doing and what level you got to. And then we want to get the ultrasound to see how it impacted the uterus. And then we want to make an adjustment and then follow you up and on that. So see your doctor on that, Lily, and get a blood test right away. So call your doctor and be seen. She goes, yeah, this is the same one. So that's a duplicate. Let's see, did we get anything else here on the live chat. Carol says, oh, thank you so much for your information. All right, let's see. I got through all that. I got through all the live chat. I don't have any science papers right in front of me. I've been working on a project on gut health for many months now, and it takes up every free minute that I do have to do. So what I would say is that being an adult, taking responsibility for your health is paramount. And dealing with adults, I have concern about having a faceless doctor from artificial intelligence. I'm concerned about that scenario emerging. But I can understand the younger generation is not seeing enough good medicine practiced, enough stable doctors. They're all being shown automation. And we had our clinicians meeting today. All of us meet once a month, and we all stop seeing patients, and money is not the main goal. It's where are we at? What are we doing every month? We have time to bring up patient cases or talk about products. Or this time we had a presentation of 3 different electronic medical records groups, and each of them, I was looking at the system, and I could see those medical record companies want our business. And it's as if they think you can think and design a electronic medical program that does it all. And I'm sorry, you'll never have an electronic medical program that does it all. You are going to have that human-to-human connection, because we are humans. I don't have any problem with some pre-visit filled out things, post-visit printed out things, but the conversation has to happen, the touching has to happen. So I have a concern about that. I have a concern about us looking to a central authority for healthcare, as if healthcare protocols can be all agreed upon. Medicine is an art. And, in healthcare, I would say maybe 18%, 20% of all the things we do or prescribe are tested with randomized controlled clinical trials, which is called the gold standard. 75, 80% of everything we do is not backed up with randomized clinical controlled trials. 70, 85%. And so we have to get this mindset out of people that we are gods, that we are scientists, that we are able to solve everything with a pill, a imaging, a protocol, a drug, that kind of thing. And so the art of medicine is to also understand our own healing abilities. If we think we can digitize and compartmentalize everything, why should you ever feel responsible for your own health? So why should you ever have to make a change or put out effort on your own? And that's the difference here. We do believe that this is a partnership. I'm a coach for the most part. I should be able to give you my field of experience, and I should collaborate with my colleagues. I should stay on top of the information as it's coming out in the peer-reviewed journals. And even in the peer-reviewed journals, they're criticized as being junk science purchased out by lobbyists and money interests. And so this whole field is corrupt. So you have to find honesty and truth. And you have to find where your level of personal responsibility is, and you have to come up with a plan. And then we meet again and we say, how is this plan working out? And then we have certain testing we can do, and we certainly do have certain specialists we can call upon. But you have to understand, health is a partnership. Written in the DNA, chapter 139 of our Bible here, everything about you is written. And that's why I cannot support any form of termination of pregnancy, because I believe from the moment you're conceived, it says you were known before you were formed. That is such a majestic, godly thing. And we have to seize that relationship and say, the body, the DNA, everything knows where everything's at what it needs. So we have to work on getting what it needs, getting rid of pollutions and toxins as much as we can, and then going forth from there and monitoring it. So that's a little time waster there. Let's see. Constance says, she said, even the veterinarian schools are woke. Pray for the animals. Okay, there you go. Yeah. And then Don says, Ion of Intelligence is an amazing product. Has truly helped me repair. Allowed with your recommendations, it pushed me into repair. Do you know about this product? It's mostly a homeric acid with water. No, I don't know about Ion of Intelligence, but I will write it down and look into it. Now, I'm working with, there's a thing called Smart Water, and I think that's a product very similar. Ion of Intelligence. This water that I just poured for myself with the salt that I just put in it here, the Himalayan salt, I turned this into a more powerful bit of water by putting the salt into it to make it more of an electrical, energetic thing going into my body. So yeah, Dawn, that's probably of value. So I will look that up. Ion of Intelligence. This is the homeric acid water. All right, and then Catherine says, thank you for all you do and share. God bless you. Hey, Catherine, God bless you too, and to your family. So I'm going to go ahead and let myself have a 2-minute rest, and we'll close this up now, and we'll see you next week at Tuesday at 6 o'clock. Again, we'll go for the chat first, and then we'll make the email secondary so the live people can get response right away. If it's of value, please like and subscribe and share it with your family and friends. God bless, and take care of your health. Bye-bye.